Kia ora, Prime Minister.
Kia ora.
Tairawhiti iwi have sent a letter, I understand, to yourself asking for military and police support to help block their roads off. They're lowly resourced, wondering if you've received the letter and if you have any plans to do anything.
Yes, I had contact from local MPs from Tairawhiti this morning raising the issues, and I know that Police Minister Stuart Nash has been in contact with the Mayor in Gisborne to directly discuss some of these issues. And equally it's being raised with Commissioner Bush. My understanding is we don't have a resource issue and we don't have an enforcement issue. The police are able to arrest and detain, if they need to, anyone who is not following the rules. But we're now working through with Tairawhiti some of their more specific concerns, particularly those that have led to roadblocks being established locally.
Just one question for Dr. Bloomfield. Do we have any numbers or statistics on Māori or Pacific who might have contracted Covid-19 and where they are?
Kia ora. Yes, we do. We've just been able to do that breakdown today, and we will provide that on the website. But off the top of my head, Māori so far at 4% of cases and Pacific 2.3%.
Prime Minister, are supermarkets going to have to close on Good Friday and Easter Sunday, and could the government amend the Shop Trading Act if it was preferable for them to stay open?
Yeah, this is something I intend to discuss with ministers. It has been raised with me as an issue, and these are extraordinary times, so I'd like ministers to discuss that issue. It's fair to say that we are in frequent contact with the CEs of the supermarket chains in New Zealand, and this is something we're likely to discuss with them also.
Would that be a decision you'd make tomorrow?
We would need to make it soon, but I would like to talk to the leadership within the chains, just because over workforce issues and so on. In fact, I intend to give a bit more of a general update around the status of supermarkets, stock provision, staffing tomorrow, but it is something that we are keeping a very watchful eye on, every element, the amount of stock that people are seeing, the ability of supermarkets to restock, any pricing issues. So I'll give you an update tomorrow. I'll just finish this line of questioning.
Extending essential businesses potentially for some of those food and produce for different online or open shops. Are you open to any changes, and is that something you'd look at tomorrow?
Again, MB have been keeping a good eye on the requests that are coming through, particularly for online provision, and I'll check in with them again tomorrow around any emerging needs. We've always said that our goal is to keep as much as possible, as many New Zealanders out of contact with one another as possible, including in workplaces. And so that's been a focus for why we haven't been liberal with online purchasing, because it's not just about the person who's making the order, but the person who's preparing the order. But we've also said that we will keep a constant assessment. So I'll look to contact MB officials tomorrow.
Just on supermarkets, we are still hearing from people who are complaining about high prices.
Yes, yeah.
Are you looking to freeze supermarket prices?
What I've asked for are specific examples that we can follow up on, and that is something that Minister Chris Farfoy has been doing. He has been very specific when he heard issues about chickens, broccoli, cauliflower. He has been quick to contact the leads of the supermarket chains to query what is going on. But I'm looking to give you another update on how we will manage this on an ongoing basis tomorrow.
Facebook Marketplace is still, people are still operating on Facebook Marketplace, apparently buying and selling goods, talking about meeting up. What advice do you have? Is there going to be scrutiny of this?
Again, if people wish to let us know via 105.police.govt.nz, those who are operating what are believed to be non-essential services, do let us know. But it's always best to do it through that form than picking up the phone. That's one way we can make sure we're triaging those calls. Toba.
How many foreign nationals are still in New Zealand to get home?
I don't have the latest number for you. We haven't had repatriation flights at a large scale yet, so my expectation is it will be similar to what we've had in the past few days.
Good question about postnatal care.
Yeah.
Do you recognise how important it is for mothers to have a support person there in the
Yeah.
immediate aftermath?
Yeah, I do. And of course, hospitals have put in guidelines around what their expectations are after mothers have had a baby. I absolutely recognise that. You can imagine it wasn't so long ago I was in that same position, but I also recognise the need to keep mum and baby safe too. And that's what hospitals are having to juggle in this incredibly difficult time.
If I can. Isn't there an argument though if the support person or the companion can be in there for the delivery or in theatre if it's a C-section, isn't there an argument that that person can then stay on to support the mother in the hours and days afterwards if need be?
Many cases those will be parents who will be coming and going because not all facilities of course have the ability for people to stay, and so it's that coming and going that presents significant risk. And I have such empathy. I have read the stories, but I've also read the stories of people who have loved ones who are very ill in hospital and are unable to visit as well. This is a devastating time that I hope no New Zealander will ever have to experience again in the future. And these are some of the devastating consequences. Dr. Bloomfield, you might have more to say on that.
Also to alleviate some of the pressure on the nurses and midwives who are caring for those mothers because they have a support person or companion who can do some of those tasks. After a C-section, for example, lifting the baby, helping to feed the mother.
We are in extraordinary times, and so in this area, of course, in the provision of healthcare, there are extraordinary measures being taken. I think the important thing here is making sure that the needs of the person, of a new mother and baby, or indeed someone who may be critically unwell, are being looked after without increasing the risk to either staff in the hospital, to other patients, and indeed to the family themselves. So extraordinary times demand extraordinary responses, and that's the situation we're in.
We'll just let Tova finish this one question.
Yeah, if there is room for them to stay in the hospital after the delivery or the operation, could that be an example where the person is allowed to stay, particularly if it's a traumatic birth or a caesarean section?
Well, I have confidence that the staff, which they do on a daily basis, will be able to assess any risk, and if that risk is low or there is no risk, then they will act appropriately. So again, there's not a single blanket policy, but our primary concern here is to break the transmission and the chain of transmission of COVID-19 in our community. The last place we want it is in our healthcare institutions.
Yep. Saying the support person could stay on if the staff, if they use...
I'm saying that staff will apply their discretion, but the first principle is we do not want COVID-19 in our healthcare institutions, and I think all New Zealanders would support that.
Yep.
Have you been in contact with the family of the deceased?
No, I have not. And obviously I'm not aware of their identity or any other details, and they have asked for their privacy to be respected. And so that is why today I pass on my condolences to them through this form.
Prime Minister, do you have an update on the New Zealanders on cruise ships in 3 separate places around the world? What's happening with them, and any other contact you might have with other countries about arrangements for New Zealand? I
haven't checked in on MFAT are doing situational reporting for us on a 24-hour cycle. I haven't seen the latest since Friday, but I will check in on that. But they are continuing to liaise. In many cases, of course, you'll be aware of some of the international reporting around the difficulty of some of those cruise ships to dock and for people to disembark. So that is one of the issues for those New Zealanders. My memory is that we have something in the order of 300 New Zealanders in that category.
Being treated as a high-risk group in terms of their exposure, given there are deaths on some of those ships already?
We're treating all New Zealanders who are coming in from international travel as high risk, and that includes those on cruise ships.
Have you given any thought, Prime Minister, to looking again at the ban on butchers, particularly around halal meat? There are concerns that people can't access
Yes,
halal.
We are aware of the issue around halal. That's something that we have had a team looking at ways that we can ensure the ongoing access to halal whilst still maintaining our goal of having as few people who are in contact with one another through being in the workforce as possible. So it is something we're aware of and we are working on.
You might be able to do that.
There has been questions over whether or not there's a way to maintain halal certification while still making it available within a supermarket environment.